Community health workers, understanding who they are, what they do, and the skills they need. In this presentation, you will learn briefly about the history of community health workers in the United States, and about the work that they do and the skills that they need in order to do that work, and current efforts to ensure that those roles and skills are suited to today's changing environment. We'll also talk about the qualities of community health workers that connect them to the community and examine how CHWs are linked to the public health workforce. This video is intended as a companion piece to a second video entitled State Policy and Community Health Workers, The Basics. Supporting materials are available to accompany this video, including a discussion guide. Please follow directions at the end of this video to obtain them. After completing this learning activity, viewers will be able to recognize varied names and definitions for community health workers, or CHWs, in the U.S., identify major milestones in the development of CHWs in the U.S., describe key components of CHW roles and how these have changed over time, describe key skills CHWs need to do their work and how these have changed over time, explain ways in which the work of community health workers is related to other members of the healthcare and public health workforce. Advocate for approaches to supporting the growth and integration of CHWs in the U.S. systems of care.
In order to better understand community health workers and to promote the integration of community health workers into U.S. health and human service systems, it is important to understand who community health workers are and to understand the unique skills they bring to the table that allow them to make a contribution to improving the health of individuals, families, and communities. Through this better understanding of community health workers, it is possible to design CHW services and policies to support their work and to secure needed resources. Whether paid or volunteer, community health workers need infrastructure provided by public health organizations and other social and administrative agencies so that CHWs can fully realize their potential as part of the continuum of caring, both inside medical facilities and out in their communities. Understanding the full range of community health worker roles, skills, and qualities is especially important for anyone working to develop the CHW workforce at the local, state, and national levels. Currently, there is no formal national consensus on the roles and skills of community health workers. Therefore, the task of defining community health worker scope of practice and related skills has been undertaken in many states. National leadership by community health workers on CHW core roles and competencies could help to shift the burden of those activities to a greater investment in supporting the workforce based on its own terms versus having states direct resources and their authority to having others define the workforce. Such national leadership is still as of yet not been asserted. In lieu of that, core roles and skills have been drawn from the research field. One study carried out in the late 90s has served as a placeholder for the field. The roles and competencies identified in that study will be shared in this presentation following a brief review of the history of the CHW field in the U.S. Through the leadership of the Policy Committee of the American Public Health Association's Community Health Worker Section, many CHW networks across the U.S. gave input on a definition of CHWs, which was adopted by the APHA as a part of a 2009 policy statement. More recently, there has been a trend among states and local CHW associations, state governments, and other stakeholders to adopt the APHA definition. Validating that decision, a 2014 national survey by the University of Arizona found that more than 90% of CHW respondents felt the APHA definition described them well. Using an inclusive CHW definition is important in light of ongoing efforts to establish stable financing for the field supporting CHWs in all settings, both clinical and community, and performing all the roles within their scope of practice. Before we turn to the major task of this presentation, looking at CHW roles and competencies, we will explore some critical elements in the history of community health workers to understand the context of the roles community health workers play today. According to the textbook Foundations for Community Health Workers, edited by a team at the City College of San Francisco and published by Jossie Bass, in the 1950s, the first documented volunteer and paid CHW programs were established in the United States. In the 60s, larger-scale programs began. The Federal Migrant Act of 1962 required federally qualified migrant clinics to conduct outreach in migrant labor camps. CHWs were hired to provide this outreach, a move that established many CHW programs. This outreach built on the promotor or promotora tradition common in Mexico and Latin America, where many farm workers were raised or had family. Community health representative programs started in Native American communities and were formally established under the Indian Health Service in contract with tribes in 1968. In the 1960s and 1970s, new CHW programs were developed throughout U.S. rural and urban communities. The Office of Economic Opportunity invested in CHWs to grow jobs. CHWs and other community-based workers were seen as critical to the reorganization of the human services system. In many states, CHWs were an important part of the community health center movement. Today, many CHCs integrate CHWs into their health promotion and related programs. These early roots sowed the seeds for community health workers serving nationwide today. This El Paso Community College billboard sign shouting, "Hire me," brings out two important factors that are part of the history and present state of community health workers. First, capacity building for community health workers through training and educational programs takes many forms. In its early years, most all CHW training was on the job. Over time, that training transitioned to include community-based freestanding training programs, and more recently, community colleges have become significant players in CHW education and capacity building. Maintaining employer investment in supporting CHW education on the job has many merits and helps to assure that CHWs with great skills and commitment who come from the communities employers are seeking to serve are able to do so if they have limited resources or have not accessed an educational program prior to considering work as a CHW. The billboard, while inspiring hope for CHWs, also speaks to the employment market that is still developing for CHWs. In many cases, employers are still unaware of who CHWs are, which is one reason for this video about CHW roles and skills. Funding streams for community health workers are still a challenge and impact employment opportunities. To learn more about policy and funding issues related to community health workers, please see our companion video. Find details at the end of this presentation. Community health workers who serve in both paid and volunteer positions go by many titles throughout the U.S., with some sources citing more than 100 different titles. Given these many names, community health workers do not always easily identify with one another. This diversity has contributed to a lack of unity in the field, made it hard to develop the field, and has contributed to CHWs being unrecognized by community members and employers alike. In response to this and other factors influencing the sustainability of the field, community health workers have been organizing themselves into networks and associations. There are currently more than 40 CHW networks in more than 20 states, with some states, such as Texas, having several associations. There are also regional and national networks, including NATURE, the Network of Community Health Representatives, the oldest and largest CHW program serving more than 250 tribes across the U.S. These networks are vocal advocates who speak for CHWs and their rights to self-determination as a workforce, to define their practice and advocate for their roles in addressing health equity in their communities. Through these networks, community health workers and many allies also work to address the patchwork of funding and support options in order to obtain the needed resources to sustain CHW work. Many research studies using qualitative and quantitative methods document the effectiveness of community health workers. In addition to studies examining the impact of community health workers, several workforce studies about the field have also been conducted. The first such national study was the National Community Health Advisor Study, carried out by a team under the leadership of the University of Arizona with funding from the Annie E. Casey Foundation to develop recommendations for the advancement of the field in 4 areas, including core roles and competencies. With some important elements of the history of the field behind us, let's begin the discussion of community health worker core roles and competencies. Specifically, we will explore the core roles and competencies identified in the 1998 study, as they are among the most widely cited and utilized in the CHW field even today. What do we mean by core as in core roles? According to the National Community Health Advisor Study, core refers to the common central elements of community health worker practice. In spite of the great diversity that can be found among community health workers, this study looked for the common core elements that were the same across programs and services rather than highlighting the differences. What do we mean by roles? Dr. Noel Wiggins in the study defined these roles as the functions that community health workers play in communities and in healthcare systems. Competencies in the study included skills as well as qualities. Qualities include personal characteristics or traits that can be enhanced but not taught. So, with these definitions in place, now let's look at the core roles and competencies that were identified in the National Community Health Advisor Study that are still very much in use today. After that review, we will look at current national efforts underway to bring a contemporary lens to the question of core roles and competencies of CHWs. We begin with roles. 7 core roles for community health workers were identified in the National Community Health Advisor Study. These include cultural mediation, bridging gaps between individual and health and social service systems. This includes key elements such as educating community members about how to use the healthcare and social service system and educating the health and social service system about community needs and perspectives. For a community health worker, bridging or interpreting involves cultural mediation, bringing understanding of cultural context between those served and service providers, unlike a formal medical interpreter who translates words and who intentionally does not offer to mediate cultural contexts and issues. Next is the critical role of health education, providing culturally appropriate health information and education that includes teaching concepts of health promotion and disease prevention. Community health workers find creative ways to teach their peers important health information. At times, this role is underdeveloped among CHWs, as administrators see CHWs as keys to outreach and linkage, and they miss the actual capacity of community health workers to deliver health information. Then comes assuring that people get the services they need or assuring access to health care and other services, which includes such activities as case finding and making referrals. Next is an important role that sometimes gets left behind in policy initiatives for fear of turf and scope of practice issues, but this role is a vital one in terms of community health workers' ability to connect with and support those they serve in achieving their health goals. The role is identified here as informal counseling and social support, and it includes providing individual support and, of course, informal counseling, and leading support groups, and helping to manage illness and chronic conditions. There are 3 more roles identified in the original study, the first of which is advocating for individual and community health needs, including such activities as acting as a spokesperson for clients and serving as an intermediary between clients and bureaucracies, and advocating for the needs and perspectives of communities. In this advocacy role, health workers take up the cause of individuals, families, and communities they serve. Next is provision of direct services, which includes providing health screenings and basic first aid, and meeting basic needs, such as food and housing. Individual and community capacity building is next. Activities and resources that strengthen and support the skills and abilities of individuals and communities are part of this role, this time including such activities as building individual capacity, helping clients change their behaviors, and building community capacity, mobilizing people to tackle tough problems as a group. This important role of capacity building, especially in communities, may at times be left behind without active efforts to maintain it within the full scope of CHW practice. At the time of the study, the role of CHWs as partners in community-based research was just emerging, but it is a role that seems to be increasingly prevalent today. Another CHW role that may stand out more today than at the time of the 1998 study is CHW's role in both individual and community assessment. Other new roles could also be identified today, but the 7, as outlined here, have stood the test of time over some 16 years, long enough to get a driver's license if they were a teenager. The 7 roles just outlined, as identified by Dr. Noel Wiggins, in collaboration with the full study team, including a National Advisory Committee made up of a majority of CHWs, offer an excellent starting place for thinking comprehensively about the scope of practice that can be undertaken by community health workers in both clinical and community settings. In order to prepare community health workers for the roles they carry out, CHWs need support in developing and enhancing their skills through quality education and capacity building. 8 core skills for community health workers were identified by the National Community Health Advisor Study through analysis of input from both paid and volunteer community health workers sharing about what skills they needed in order to carry out their daily work and community activities. The 8 core skills include the following: Service coordination skills, which includes the ability to identify and access resources, network and build coalitions, make appropriate referrals, and provide follow-up. Skills which are of great value in navigating complex systems of health and human services. Then comes advocacy skills to support the advocacy role. In the advocacy area, abilities identified include speaking up for individuals and communities and withstanding intimidation, ability to use language appropriately and effectively with different audiences, and overcoming barriers. CHWs need support in developing these skills to be effective in promoting the health of individuals and families in their communities. In the capacity building skill area, the study findings grouped abilities in two major areas: empowerment skills and leadership skills. Next comes organizational skills, including the following identified abilities: goal setting, developing an action plan, balancing priorities, and time management. Organizational skills are critical to enabling CHWs to carry out multifaceted roles that they play. Continuing with skills, we come to communication skills with an emphasis on use language appropriately and confidently, listening, and written communication. Next comes interpersonal skills with an emphasis on relationship building, including development of abilities, informal counseling, and even friendliness and sociability. These skills may play an essential role in reinforcing the supportive relationship that CHWs develop with those they serve. Another core skill is teaching or educating and facilitating, including abilities to share information one-on-one, use appropriate and effective education techniques, plan and conduct a class or group presentation, and find and request information and bring it back to the client. This skill area can be overlooked, as mentioned earlier in the discussion of roles, if CHW's roles are narrowly defined. But CHWs excel in teaching their peers, and giving them the tools to do better at that is an invaluable aspect of building CHW capacity. A final area that was deemed as a critical skill area for community health workers by the majority CHW Advisory Council of the study, in coordination with Dr. Wiggins, is what the study called knowledge base. In 1998, knowledge base was identified to include three distinct areas: knowledge about the community, knowledge about specific health issues, and knowledge of the health and social service system. Today, various other areas core to understanding public health could be included here, such as understanding social determinants of health. The knowledge base area can count for many hours of CHW education, and it may come from a wide range of sources. These 8 skill areas are the starting point for many training and educational programs and form the basis of a number of community health worker certification programs today. Emerging skills continue to be identified related to new areas of work CHWs carry out, such as activities related to individual and community assessment and increasing needs for understanding technology and options for documentation. But the 8 outlined in the study are the best documented and recognized today. As mentioned earlier, community health workers' competencies also include core qualities or attributes. 18 were identified in the National Community Health Advisor Study. Here we highlight just a few: desire to help the community, empathy, persistence, respectfulness, and, most importantly, relationship to the community served. Some say the most distinctive and important quality of community health workers is the quality of their connection to the community they serve. Well, that may be membership directly in the geographic community or social network. Because of shared life experience, they possess an unusually close connection to the community, and that changes all the roles they play and the way they are perceived. It is what makes them unique within a healthcare provider team and makes them key advocates in community wellness efforts. The battle to define this in public policy and in hiring practices vexes many policymakers and the best of administrators, but this quality is central to who CHWs are and why they are uniquely effective in impacting the lives of the communities where they themselves live and work. The core roles and skills from the National Community Health Advisor Study were an important leap forward for the CHW field and have stood the test of time, but CHW roles have evolved with new thinking in public health and healthcare. It makes sense to evaluate and refine our assumptions in the 1998 study's roles and skills and see how they fit today. In order to do just that, a national team was assembled, including several individuals who were involved in the original study, to compare the roles and skills from 1998 to to more recent, well-established benchmark scope of practice documents and CHW curricula and skill guidelines. The Community Health Worker Common Core Project, or C3 project as it is known, is coordinated by the University of Texas Project on Community Health Worker Policy and Practice, with funding from the Amgen Foundation, and administered by the National Area Health Education Center Organization. The C3 project aims to offer contemporary 2015 recommendations for consideration and adoption throughout the U.S. related to CHW core roles or scope of practice, CHW core skills and sub-skills or topics, and to reaffirm the importance of CHW core qualities or attributes, such as connectedness to the community served. A core value of the project is supporting CHW self-determination, and to that end, the project recommendations will be released and reviewed by state and local community health worker networks around the country before wider endorsement is sought.
Often, people ask, what is a community health worker? Who are they? What do they do, and how do they do it? Are they outreach workers, peer educators, promotores de salud, even tribally based community health representatives? There seem to be so many diverse names. Those names reflect the diversity of the CHW field and mirror the many distinct settings and communities where CHWs serve. Are there paid CHWs and other CHWs who get stipends or even volunteer? Well, mostly CHWs are paid. Hopefully, they are paid a good living wage with benefits. Some CHWs volunteer, some because there is still limited stable funding for CHWs, and some volunteer because they want to give their time to their community. Even with all these differences among CHWs, hopefully you know a lot about what CHWs have in common. One thing you should know is that even if CHWs are not all paid or not all paid the same, CHWs are deeply committed to supporting the individuals and families where they live and work. They are part of a continuum of caring. Another important thing that CHWs share in common is their core roles and competencies, including their skills and qualities. Many people have looked to the 1998 National Community Health Advisor Study for a starting point. The study identified 7 core roles, which help define CHW's scope of practice. These roles include cultural mediation, health education, assuring access to health care and other services, informal counseling and social support, individual and community advocacy, provision of direct services, meaning health screenings and basic first aid, and individual and community capacity building to strengthen and support the skills and abilities of individuals and communities. Programs and policies to support CHW service development should ideally position community health workers to fulfill a wide range of their core roles. What happens if CHW roles are too narrowly defined? Let's take a look at what happens when a CHW works in a narrowly defined role. If a CHW teaches Diabetes 101 in a classroom but does not have the opportunity to talk with those attending the session, she cannot offer social support. Given this narrow role of health educator, the CHW might not touch the lives of those she serves, and the participants might once again be overwhelmed with the medical information about their chronic condition. They will miss the benefit of an informed ally who they can talk to about the changes they want to make and how hard it is to make them. Their condition is poorly controlled, and they may find themselves in the emergency room once again. If we want community health workers to carry out a wide variety of roles within the community, we need to make sure their training gives them the right skills. Dr. Noel Wiggins, who led the examination of roles and competencies for the National Community Health Advisor Study, identifies 8 core skills that CHWs need, including communication skills, interpersonal skills, service coordination skills, capacity building skills, advocacy skills, teaching skills including facilitation, organizational skills including setting goals, planning, documenting, and research, and a general knowledge base, including knowledge about the community, specific health issues, and health and social service systems. The study also found that CHWs have many important qualities, the most unique and important of which is that CHWs are closely connected to the community they serve, sharing life experience. You may wonder whether these roles and competencies represent today's reality for CHWs as they did more than 16 years ago when the National Community Health Advisor Study was released. That is the purpose of the National Community Health Worker Common Core Project, also known as the C3 Project. Many of the same people who worked on the National Community Health Advisor Study are part of the C3 Project. The C3 Project is focused on building forward from the National Community Health Advisor Study to offer contemporary guidance on CHW roles and skills that support the work that CHWs do today. You may also wonder, what about guidance from the C3 Project on CHW qualities? The C3 Project recognizes the importance of the qualities that make CHWs effective, including their close connection to the community. The project team, like others, recognizes that those qualities are timeless and have not and will not change.
So what is the C3 Project doing to update the National Community Health Advisor's core roles and skills? A key first step was the decision to use a selection of benchmark documents as a starting point for comparison. These include both scope of practice documents describing the roles of CHWs and well-established and respected CHW curricula teaching core CHW skills. The project implementation team selected 7 source documents for roles and 6 source curriculum for skills. These materials came from 6 states: California, Massachusetts, Minnesota, New York, Oregon, Texas, and scope of practice guidelines from the Indian Health Service Community Health Representative Program, supporting U.S. tribally based CHW programs. With the benchmark documents in hand, the C3 project team conducted a crosswalk analysis looking at CHW roles and skills. The crosswalk produced a matrix document comparing the National Community Health Advisor roles and skills on one axis against the 7 benchmark documents on the other axis. The focus of the analysis included 4 primary elements. The first was to identify new topics not expressed in the 1998 study. The second was to look for new organizations or groupings of topics. The third focus was to look for contemporary language and any nuanced concepts reflected in that new wording. And a final focus was to identify any topics no longer being examined in the more recent scope of practice documents and curricula. As already mentioned, the goal of the C3 project in the short term is to reach community health workers and other key stakeholders in the field and have community health workers and their allies help guide the initial refinement and adoption of proposed core roles and skill recommendations. As that process moves forward, the C3 project team aims for building a national consensus on the roles and skills and ultimately hopes for the wide utilization and endorsement of C3 recommendations by local, state, and national CHW organizations and those seeking to start and or support CHW educational programs or leading the development of CHW practice and policies. The C3 project recommendations for contemporary community health worker roles and skills will be released in the spring of 2015 to CHW networks and associations. Copies of the report can be requested at info@c3project.org. Full release is anticipated in the fall of 2015. At the time of this recording, C3 project preliminary findings are being shared. Among the early findings are newly proposed roles and skills related to community health workers as integral members of community-based research teams and greater recognition of community health workers' roles and skills focused on individual and community assessment. These possible new additional CHW roles and skills will be carefully reviewed before they are adopted, but the idea of these updates reflects important growth in the field. So far, we have learned about who community health workers are and what they do, and even how their roles and skills may be changing with time. Let's now take a look at how community health workers fit into the public health workforce. For more than 20 years, the public health community has been developing standards for the workforce in order to strengthen public health practice and research. According to conveners of that work, the Council on Linkages between Academia and Public Health Professionals, the frontline entry level of the public health workforce includes a wide range of individuals carrying out many public health activities. Community health workers are generally determined to be within this front line until, as defined here, they grow into management roles such as supervising other Tier 1 workers, including, in many cases, community health workers. In the 2014 review of Public Health Core Competencies, the Council on Linkages affirmed the core competency domains of the public health workforce, identifying several areas that overlap with core competencies of community health workers. These include assessment skills, identified in the preliminary findings of the C3 project, and longer-standing communication skills and cultural competency or mediation skills. While overlap is evident, there are clear areas of distinct practice. For example, there is a domain of public health practice in the area of financial planning and management that does not appear to be an overlap. A policy development and program planning domain has not been articulated as part of community health worker roles and skills. However, given the work of community health workers in advocating for communities and also for self-determination as a workforce, such a domain may at some point be identified as a primary domain. The often cited 10 essential services of public health were developed by the Core Public Health Function Steering Committee that worked from 1994 to 1999, overlapping with the work of the Council on Linkages just discussed, and notably with the National Community Health Advisor Study carried out from 1994 to 98. The relatively short-lived Core Public Health Function Steering Committee left an enduring contribution to defining public health practice. The 10 essential services, following under the 3 core functions of assessment, policy, and assurance, share many common elements with the currently articulated roles of community health workers, including, for example, such essential services as informing, educating, and empowering people, or the service labeled Mobilize Community Partnerships and Action to Identify and Solve Health Problems, and the service named Develop Policies and Plans that Support Individual and Community Health Efforts. This overlap once again affirms that community health workers can be easily defined as the front line of the public health workforce, who can play a vital role in primary, secondary, and tertiary health promotion and prevention service delivery. No formal crosswalk has been conducted to date between the public health workforce and community health workers, but clearly there is reason to explore the many common elements. Still, in spite of that overlap, community health workers have a distinct and valuable role to play when their core roles, skills, and qualities are fully expressed where they serve. Community health workers are a powerful force for promoting public health from within communities, and they help to provide the public health workforce with a front line that is diverse and reflects the strengths and the uniqueness of the neighborhoods and communities across this nation of which they are a part. Neighborhoods and communities that are often under-resourced and underserved. Community health workers work directly on public health issues, including such health conditions as asthma, diabetes, and HIV/AIDS, and such issues as access to health care and housing, and family and community violence. In this presentation, we have offered a portrait of the full breadth and depth of community health workers' roles, skills, and qualities that optimally need to be supported in order to harness the full potential and power of their contribution in promoting health equity and ultimately the health and wellness of the individuals, families, and communities they serve. And last note, thank you for watching this video. At the very end of the presentation, there will be links to obtain a study guide and other useful materials on CHWs. We would like to now offer some questions to help you reflect on your learning and on practical aspects of understanding community health workers' roles and skills and how they relate to community health worker practice and policy in your own community and across the U.S. For a more advanced discussion of the issues facing the field, be sure to see our video on community health worker policy. Find the link just after the upcoming self-assessment and discussion questions. Thank you for your attention and interest in community health workers and supporting their place in the continuum of care.